So we're going to cover a few things. Most of this stuff is going to be a little bit more medical school centric. Who here is interested in medical school? Raise your hand real quick. It's typically the largest population of this cohort or this group. Who here is next largest is typically PA. How many PAs we got in here? Okay, and then dentistry, a couple veterinary medicine. All right, and then what else am I missing? Optometry. Any optometrists? No. What else are you guys? Are there people interested in CLS or PT programs, nursing? So a few nursing. Okay, so I will cover a lot of the information on here again specifically for med school, but I will include a few little excerpts here. When it comes down to standardized testing and stuff like that, I'll talk about the subtle differences between the different paths. But again, at the end of the day, a lot of the things you need to do for any of these health professions are all going to be the same. You need to get good experience, you need to do volunteer hours, you need to do all that sort of stuff. So I'll walk you guys through what typical expectations are. I have a lot of statistics that I have pulled off of the different sources, especially GPA, test scores, stuff like that. So I'll give you a realistic idea of the numbers it takes to do these sorts of things. Write down the information that you want. There are going to be, again, a lot of data up here. Most of the examples are a little bit medical school driven though. So just to begin real quick, I got some emails from people. We do not meet during finals week. Okay, so we have no official meeting during finals week. Our last official meeting is the last Friday of classes, which I believe is the 11th. Okay, on the 11th, one of the things, if you guys remember the syllabus, that I need from you guys, we have a paper that's due, right? So this class is, a lot of it's just showing up, and that's why I have you guys sign in. But one of the other things I have you guys do is, there's a paper due. It's on the syllabus, so the syllabus, if you haven't been to the Moodle site, you can go to the Moodle site. You can download the syllabus, and it has all this information up here. And the paper is really a little bit for your own benefit. I want you guys to tell me why it is you want to do health professions. Whatever profession you choose, so it's a pretty straightforward paper. Tell me what profession you want to actually pursue, okay? And then tell me why you want to do it. That is a very simple essay prompt, and I guarantee you any professional school you apply to will ask you for the exact same essay. A lot of schools call this the personal statement. So if a school has you write a personal statement, think of this as a rough draft. This is your first chance to really put on paper why you want to do the things you do. So after you write this paper, save it. Don't just throw it away. Don't lose the file. Because when it comes time to actually applying for these things, you will already have a rough draft. Okay, so use it in that context. When I read these things and grade them, I'm not going to grade them like an English professor would grade them. I'm just grading them to make sure they're coherent and that you're not saying anything illegal, I guess. But you want to, use it to explain your rationale, why you want to do the things you do. And the last part there is also a little bit for yourself. Choose a school. Choose your dream school, whatever that dream school is, and go to the website for that school. Look up the specific requirements for that school. There is some differences among all the different schools, and that you want to make sure you're familiar with them. So this is, again, just a little bit of an exercise. Look up the specific school you're interested in, the specific program you're interested in, and on all these websites there'll be a little link there that says prerequisite courses, prerequisite exams. Look at what they specifically want. And then try to figure out, okay, if they say 1 year of general chemistry, what class does that correlate to here at Sonoma State? Okay? And again, it's for your own interest. Make sure you have an idea of what classes you need to take. Make sure you start putting a timeline together. A lot of these things will start happening very, very quickly. Who here is a junior or senior? So some of you guys are closer to the end. And you will see that the deadlines are going to start showing up really quickly. And I'll walk you through some of these timelines in a little bit. So this paper is due at the very, very beginning of class, December 11th. I want a hard copy. Just make sure your name's on it. Pretty straightforward. There is no wrong answer here. Just make sure it's coherent. And then the final exam, it's going to be a very simple multiple choice. If you had a pulse and were awake during this seminar series, you shouldn't have to worry about it. Don't sit here trying to memorize the contents of the reader. That's not worth your time. The reader is really just an information resource for you guys when it comes time to preparing and applying. This is just to make sure you're here. and it shouldn't take more than 10-15 minutes. Okay, so that's going to be our last meeting. Our last meeting is on the 11th. It won't take the whole period. And then finals week, again, we're not going to meet. Okay, questions about the paper or about meeting? The attendance thing, basically this is a credit, no credit class. So if you've been showing up, you won't have an issue. If you have missed more than 2 meetings, you will not get credit. Okay? At the end of the day, no credit isn't the end of the world either. So, you know, it is what it is. And that's why I keep track of the roll. Okay? Okay, so what classes do you need during your time at Sonoma State? And again, this is a little bit medical centric, but it is true for the vast majority of health professions out there. Veterinary medicine, dentistry, things like that. And it really comes down to something fairly simple, right? You need a year of biology. You need a year of general chemistry. You need a year of organic chemistry with lab. Typically need a year of physics, a year of math, and a year of English. And those are the basic requirements. You know, some schools might want you to take biochemistry. Some schools don't care if you take biochemistry. Some schools want you to take more psychology, sociology. Some schools don't care. So that's actually why I encourage you to look at the specific school, your dream school that you're interested in. Because again, if that's your dream school, you want to put yourself in a position that you can get into those programs. Okay, so what does that mean in terms of how to plan? Who here is not a bio major? Okay, if you are not a bio major, you're still fine. The hardest part of not being a bio major is that when it comes time to the standardized testing, you're not going to have as much biology background as a biology major. But the interesting thing is that medical schools have done a lot of statistical analysis, and if you look at the standardized test scores for biology and biology majors, non-majors actually in general score higher than biology majors. So what does that tell you? I don't know. It means that the non-biology majors are typically really, really motivated if they want to go to medical school because they kind of have to be. Okay? So biology classes put you in the best position to do this. We have a lot of suggested classes. Most medical school curriculum these days are geared more towards molecular cell biology, biochemistry. You know, physiology and things like that are great courses, but modern medicine is mostly a molecular and cellular discipline these days. Okay, so we'll talk about the rationale and why you want to take some of these courses. Again, some schools require them, some schools don't. These are other classes that are good for preparation. And we'll talk about what sorts of things will show up on standardized testing. So, things to keep in mind, this is just a guide. Again, specific schools will have specific requirements. If in doubt, check with the specific school you're interested in. Your major does not matter. So those of you guys that aren't bio majors, that's perfectly fine, and in some contexts, it's actually better. The vast majority of students that apply to pre-health programs are biology majors. So if you want to stand out from everyone else, being a non-traditional major is actually a pretty good way to do it. Doesn't mean that you can't be competent in sciences. They will still look at your science GPA. They will still look at your sciences on your standardized testing. But if you're a history major, or you're an art major, or something like that, you're going to bring something unique to a program that is typically anywhere from 60 to 75% biology majors out there. Okay? This is the other thing. The BA versus BS doesn't matter either. So those of you guys like thinking about, oh, I have to do a BS, it actually doesn't matter. Do the path that makes the most sense for you. Those that go traditional medicine, BS does make more sense because the requirements for medical school fall more in line with the BS. But if you don't want to do some of those BS requirements, there's nothing wrong with doing a BA and then taking those few extra classes that those pre-professional programs actually require. Okay? Here are a few of some of those classes. Microbiology is typically required by PA programs in vet schools. Human physiology is a PA program. Anatomy is PA. And a lot of schools actually want social sciences. And that, again, just to give you some sort of breadth, especially PA programs like social sciences. Most people think, oh, I have to take anatomy if I want to go to medical school. That's actually not true. The vast majority of medical students don't take anatomy before they get to medical school because they're going to take anatomy in medical school. Not every school actually teaches anatomy. You just happen to be at a school that does offer anatomy. So you can take it, but it's not a requirement for a lot of programs. And that's why I, again, encourage you to look into the specific requirements of specific programs. Questions about these sorts of classes? Yeah?
I was looking on like the and it's like the GD page with all the courses, and like the one with the path for like bio majors. And I couldn't find human physiology anywhere. They had like animal and plant.
Yeah, so human physiology is a nursing class. This is a lower division nursing class. So typically biology majors do not take it. Kinesiology and nursing are the two majors that take human physiology. PA programs, a lot of them specifically want you to take human, not animal. And so what that means is that you will have to get special permission to take this class, which many students do. Human physiology is also nice because it's offered in the summers and things like that. But it is not a traditional biology major class. And if you do want to do PA, you will have to take that on top of your normal biology major load.
So can you can take that as a under GD, like a freshman sophomore class?
The prerequisite for human physiology is probably an intro bio series.
Okay.
So you would probably need to either take at least 110 or 115 depending on your major. If you're a biology major, you would probably have to finish 130 and 131 before you took it. But most people would probably take it their second year after intro bio series. Okay. Any other questions about that? Okay, so let's think about the timeline, because this is one of the things that sometimes catches students off guard. I'm going to turn the lights on real quick. So when we break down the timelines, right, we're talking about fall, spring. Most of you guys are freshmen? Raise your hand if you're a freshman real quick. Okay, so most of you guys are freshmen. So if you're a freshman, we're in fall 15. Okay. Okay, so here's our breakdown of years, right? We're here. If you're a first-time freshman, we're here. That means that if you want to apply, if you want to graduate here in 4 years, you would start your professional school here, right? So we can start back planning for the future. So professional school here. That means that you need to finish all your coursework, you need to finish all of the standardized testing, everything obviously before you get to this point. Now the one thing that a lot of students don't realize is the application process is actually a very long process. If you want to apply to start school here in fall of 19, the applications begin back here in June of 18, right? This is when the application cycle starts to start here, okay? That means that you still got a lot of time afterwards, but the key here is that if you say, oh, I'm gonna do those later in my years, remember, if you're applying here, anything you do here and here isn't really gonna show up on your application during that first pass, right? That's why you gotta plan ahead. So when you guys all had freshman orientation, one of the classes we really told you guys to take, Biology 130, then we want you to take Biology 131, we want you to take Chemistry 115A, we want you to take Chemistry 115B. Now the reason we want you guys to front load these science classes is because you need to get them done before here. Most people take the MCAT or whatever standardized testing, and med school is a little front shifted. Dental schools are a little bit maybe towards the end of summer, depending on what system you're working through. Vet school is the same. Summer is where a lot of these applications are starting to basically be accepted. So standardized testing, a lot of kids want to try to do it in April or May, right? It takes a month for them to grade your exam, typically. So you take it in April and May, you start applying in June. Well, what's happening in May? You guys have finals, right? Do you want to take your standardized testing during the same time as you're taking all these other things? And so that's why it's really important to start planning ahead, figuring out your schedule. So here's your intro bio, intro chem. That means you're going to do more bio here. This is typically 320, 321, right? And then you have OChem here, 335A, 335B, right? And now this is your last year to really take classes you need before the MCAT. Okay? So what do you need? You need physics, right? You need sometimes biochemistry, right? You're going to take more biology, right? And that's why the reality is you're on a very tight timeline for the classes you need to prepare yourself for the MCAT. That 4th year isn't going to help you on standardized testing because it's after the point that you've taken it. And so the reality is, while it's great to graduate in 4 years, it's a little bit more manageable if you actually do it in 5 years. And that, yes, 5 years in college seems like a lot worse than 4 years, but the reality is you want to put yourself in the best position possible. If you start cramming in as many classes as you can, one, your grades in your classes probably won't be as good because you're taking on way too much, right? You're going to try to cram in all those classes before you take your standardized testing. Again, that's a lot to take on. So, while some students can do it in 4 years, it's not the end of the world to stretch it out to 5 years. Because what else do you have to do during all this time? Volunteering, job shadowing, collecting hours of experience, and that is a lot to take on. Okay? So I'm not saying don't do it in 4 years. If you can do it in 4 years, especially those of you that brought in a lot of AP credits and stuff like that, that's great. But it is a very tight timeline, simply because most people don't realize your last year is kind of a throwaway year in terms of preparation for professional schools. Okay? Okay, so what does this mean for everything in the big picture now? The powers that be, especially for med school, always put out these little pathways they want you to follow, and you can see a lot of these things don't specifically address your grades and things like that. They want you to make sure you know what you're getting yourself into. So explore your options for careers in medicine. A great first step is a class like this. You know, you saw traditional MDs, you saw DOs, you saw podiatrists, you saw chiropractors. So it gives you a breadth of all the different health professions out there. There are a lot of pros and cons between the differences. You know, some programs are 3 years. You want to be a neurosurgeon, you're going to be in school for more than a decade. So that sort of stuff plays into how you're going to prepare yourself. Getting exposure to the different paths is part of this whole process. And then you can see here, get some experience. So there's your first year, here's some experience, right? There's a summer. Basically, if you can get research or internships, right? Start thinking about how you're going to apply, right? Then you're going to take your MCAT, and then you're going to prepare for interviews and hopefully get ready for medical school. So all of these sorts of things are really important to keep in mind. You don't want to just focus on test scores and grades, but it's very, very important. So what does this mean? It's not just about test scores and grades. This means that good grades and test scores don't guarantee you admissions anywhere, but bad test scores and grades will basically keep you out of a lot of places. Okay? There are a lot of students with really great grades out there, and I like this picture here because there's so many kids out there that all look the same. They all have really good test scores, they all have really good grades. So how are you going to be different? What makes you a better candidate than somebody else? All the measures based on numbers, there's an endless sea of students with great grades and great test scores. You need to convince a medical school that they want you. And now you can start to get a sense of, well, why does it matter if I'm an art major and everybody else is a history major? Because you bring a different perspective. So if you are of another major, don't feel the pressure to have to be a bio major. There are plenty of successful doctors out there that weren't biology majors or even science majors. I have a lot of friends. I have two good friends that are both MDs that were music majors in college. And so, again, as long as you're well prepared, it doesn't matter what your major is, and it helps you stand out. You need to find a way to make yourself different than everyone else. So, other things, you need to convince them that you know what you're getting yourself into, and this comes from shadowing, work experience, volunteering. Some programs have very, very specific numbers they want you to hit. Some PA programs say, at minimum, we want to see 1,000 hours. 1,000 hours is a lot of hours. So are you going to be able to do that during all of the coursework that you have to do? Summers are great. If you can get work, internships, things like that, do those sorts of things in the summer. If you do an internship, a lot of times we can actually give you course credit for internships so that at least you get some units out of it or something like that. Come talk to me if you have opportunities like that. Research internships are good, but if you want to do health professions, find things that interact with patients, right? Be in a clinical setting, whether it's a free community clinic, whether it's volunteering in a hospital, whether it's scribing. Some people will actually go get an EMT certification. Some people will go get a phlebotomist certification or a respiratory therapy certification. Anything that gives you access to patients, because that's the only way you're really going to know if that's what you want to do day in and day out. Okay? So keep in mind that you want to get as many other opportunities. And one thing that I do want to stress is that some people say, well, how am I supposed to do all this volunteering if I have a job and if I have other responsibilities that aren't medically related? And that's okay. People realize that if you have to have a job to support yourself in college, that's not a bad thing. When you explain these sorts of things or you put these things on your application, make sure you give them a positive spin in terms of, well, if you're working retail but you're a managerial position, why is that good? Because it shows leadership skills, right? It shows that you're going to be organized. You can manage other people. So while clinical experience is very important, don't necessarily downplay or think that if you work jobs non-health related that they don't mean anything. They're all valuable experiences, and there will be opportunities when you fill out the application to put those sorts of things on there. Okay? Questions about this sort of stuff? Yeah?
So like, what about volunteering outside of like medical stuff, like say like an animal shelter? Even though I don't want to be a vet, is that still like look as good, or do they really not care?
Any volunteering, so what I will say is things that you are passionate about that come through on your application that you're passionate about is a good thing. Some things that you don't even realize might be applicable. So we had a student from here 3 years ago applying to dental school. And we were talking to him, we were doing a mock interview, and we were looking at his application. And we noticed that he grew up playing the saxophone. We're like, okay. He didn't really talk about it that much in his application, but why would that be important? Who here wants to be a dentist? Why would playing a saxophone matter? Yeah.
Manual dexterity.
Exactly. Right? Dentistry is a lot about working with your hands, a lot about manual dexterity. And he had this extensive background playing jazz saxophone. And those are the sorts of things. It's something he was passionate about, something he really enjoyed, but he didn't really think it applied to dental school. And so those are the sorts of things. Sometimes it's not an obvious link, but if you're passionate about something, spend a lot of time, hours into it, that will come through an application. Yeah.
Also, like, if you did stuff like science related, but it wasn't necessarily in college, it was like before you got there, can you talk about that, or did you not really care unless it's like...
Most people will want to know what you did in college. While you could probably put some things, some applications will specifically say in college. And again, things that you did in high school, if there are things that you can continue doing in college, that's great, whether it's following up or, again, people that you used to know, stay in contact with them, still work with them. Most people want more recent experience. Other questions? Okay. So I'm going to talk about the MCAT here a little bit, and again, it's going to be a little bit similar for other tests, but what is on it? So most of you guys may or may not know now, the MCAT got completely revised in 2015. So this was the first year of a brand new MCAT. The old MCAT had a different scoring system. The new MCAT obviously has a new scoring system, but they broke down the topics slightly differently. Okay, so now what's on the MCAT, there are 4 major sections: biological, biochemical, foundations of living systems, chemical, physical foundations, right? So psychological, social, behavioral type things, and then some sort of critical analysis, reasoning skill set. So the old MCAT used to have an essay writing section, no more writing section, right? Now we're broken up into 4 sections. Basically, biology, biochemistry, chemistry, physics, right? A little bit of behavioral sciences. And this is why we typically tell you, take Psych 250. It's not an absolute requirement for a lot of schools, but if you're going to prepare yourself for the MCAT, Psych 250 is a good class. It's an intro to psych. Just like biochemistry is not a prerequisite for a lot of medical schools, but if there's biochemistry on the MCAT, you should probably take biochemistry course, right? So this is not a recall test. What I mean by a recall test is they're not going to ask you what is the second enzyme in glycolysis. That's not the point of these sorts of tests. These sorts of tests are typically going to be structured like you read a passage, you're going to have to rely on your foundational knowledge, and then they're going to ask you specific questions. So all the information is not going to be in the passage, but the passage is there to set a stage for the types of questions that you will have to answer. There are a lot of great test prep books out there. There's an official guide. Here's an official guide for the MCAT. There are copies of these books in the HPAC office. It's the biology office as well. If you want to look through these, but these are the official books that are put out by the testing service, and it basically gives you a bunch of examples of the types of questions that these tests will ask you. So you can buy these. I think they're like $30 or $40 or something like that. But you can also just flip through it if you want to look at it in the bio office. Okay. So they're going to really test to see if you can synthesize concepts. This is how the scoring is going to work now. There are 4 sections, like I said before, and that every section is basically a range from 118 to 132. The 50th percentile is 125. Okay, so breakdowns are bell-shaped curve. 50th percentile is 125. And so that means the 50th percentile of all 4 sections added together gives you 500. Now, scores, again, this is for the MCAT. Scores for any standardized testing, what I will tell you personally, you're trying to aim for about 70, 75 percentile to be pretty safe. What does that mean? That means if 100 people took this test, you should probably be in the top 30 to 25 of those people, okay? To be competitive, right? So, yes, if you don't do great on that, can you still get into some of these programs? To some extent, and I'll show you some of the numbers. But again, if you can, aim for like the 70, 75 percentile for a lot of these sorts of things. So again, independent of what's the MCAT, the GRE, the DAT, whatever, 70 to 75 percentile is a pretty good number. So here are the scores. So the problem is all the numbers that I can access are for 2014 and before, and that was the old scoring system. Okay? Who here is familiar with the scoring systems in general? A little bit? Not really? Okay, so this is the old scoring system, and what I will tell you is that the old scoring system used to have 3 sections. It used to have a verbal, right, a physical sciences, and a biological sciences, right? And that in the old section, it used to basically go from 1 to 15. Right? So 10 is basically the mean for the verbal. You can see physical sciences, 10.6. You can see the biological sciences, 10.9. The average score for a kid going to medical school in 2014 was a 31.4. Okay, 31.4. This is kind of a general conversion. 31.4 here. You're looking at like a 510 on the new scoring system. So again, these numbers, think about what they mean to you, right? 127 for each section gets you about a 508. You know, that's a nice number to aim for. If you aren't good at standardized testing, what can you do about it? Well, there are test prep courses out there. You can always do those sorts of things. Again, there are no guarantees that they're better. What I will tell you is that when you are studying for the MCAT and you take practice tests on your own, the vast majority of students I know that do practice tests from the actual testing service score pretty close to what they ultimately get. I know a lot of the scores from students from the past here. You know, I've been here, this is my 7th year here. The top students at this university, the best MCAT score I've seen come out of this university from a student I knew personally was about a 33. Right? And so, you know, they cleared the average easily to get into medical school, and they got into medical school. But I'll show you a little table here. Let me go to this table here real quick. This is a table of GPAs and MCAT scores. If you get, so let's say you get a 30, right? You can see, well, if you get a 30 on your MCAT score, these are the GPAs, right? So if you have a high GPA and you get a 30, that's about a 76% chance that you will get into medical school. All right? Now you can see that percentage drops precipitously. If you have, let's say, a 3.3, right, and you get a 30, you only got about a 35% chance of getting into medical school. So this table helps you understand the relationship between test scores and your GPA. So if you're in the, let's say, 3.0 range, and you're like, yeah, I know my grades suck, but I'm going to do really awesome on the MCAT. right? Well, how awesome do you actually have to do to do well? Even if you got almost a perfect here, you're only still about a 50% chance of getting in. And like I said, the best student I've ever seen come out of Sonoma State, personally, got about a 33. You're around that range. Okay, so you got to be realistic, and I'm not showing you this to dissuade you, but these are the real numbers from the real medical schools. And so let me backtrack here. I always say, where do people want to go, right? People, typically, you guys are all from California, so it's great because you have slight preference for the California public schools, right? Where do people want to go? Usually if you're from the Bay Area, where do you want to go? Where do people want to go? UCSF, UC Davis, schools like that, right? And you can kind of look at the numbers. Here's UCSF. They had 7,500 applicants, right? How many people showed up for the first day of class? 165, right? That's a pretty low percent. So it's about being realistic. You know, there are a lot of medical schools. Yes, you have your dream school, but there are a lot of schools out there. Outside of California, it's a little less competitive. But be careful when you apply. A lot of public schools outside of California will favor their own state residents, just like California favors California state residents. Other public schools, there are a lot of private schools out there. Their numbers are a little lower. And so just, you know, look at these numbers, see how you're going to fall. Look at the numbers like this. So my recommendation for most students who want to do pre-health, if you're thinking about traditional medical school, I want to see you get about a 3.7. And I want to see your MCAT score around a 30, or, you know, whatever the new system number is now, 508 is a pretty good number. Okay? And that's something to aim for. If you're below a little bit, that's fine. If you're above, that's great. But if you, and I say this kind of joking, but it is a little bit true. If a student comes to me and says, oh, I'm going to apply to medical school after I retake these classes I failed, that's not a realistic approach to how you're going to do this, right? If you're failing your classes, it's not a good sign. Okay? So keep in mind these GPA numbers, keep in mind these test scores. Yeah?
Why is MD so much more competitive than the DO route?
Typically, it's just the desire of what people want to do. DO schools fall into kind of two categories. The DO traditionalists, meaning that people wanted to have an alternative way to treat patients, and that's why the DO hands-on approach is somewhat is different. The reality is the DO approach typically is not driven by mainstream academic research medicine. What I mean by that is that if you want to do cutting-edge therapies in the top-tier hospitals, academic teaching hospitals, you're not going to be at a DO school. If you want to do academic medicine, like if you want to be a doctor at UCSF and doing clinical research in cutting-edge settings, they're typically not going to DO programs. DO programs are much more catered toward people who want to practice medicine primarily, not necessarily do research. A lot of them want to do family practice, family medicine, just less research-centric medicine. And so it's just a different way of doing medicine. It's a little bit selective just because it hasn't been around as long, or at least hasn't been mainstream as long. There are a lot fewer schools for them though, so it is actually, you know, you'd think fewer schools means it'd be harder to get in. But again, I think just a lot of students aren't interested in that type of medicine. One thing to be careful of, and a lot of schools realize it, that DO is almost like a backup for an MD. And in some schools, they acknowledge that and they're okay with it. Some schools will not take you if that's clear. Because especially like Toro and Vallejo, they're very traditionalist DO schools. There are other DO schools that are, again, private schools that know they just need to make some money, get some students, and that they'll still teach a DO philosophy, but they're not going to use that as much as a criteria to take you. Yeah.
So do PAs have to take a test?
PAs typically do not, depending on the school, but as far as I know, most PA programs do not have you take a test.
They're not what?
Do not have you take a test. As far as I know, most PA programs do not.
Okay, so I was going to say they're not competitive like this.
They're not going to be driven by MCAT scores, obviously, standardized tests, but to be a competitive PA, I want to see you in around 3.3 to 3.5 GPA at least. PA, the limiting factor is mostly hours. A lot of those schools want thousands of hours. So most PA classes are actually not kids right out of school, right out of college. They're people that graduated college, worked in a clinical setting, worked in a hospital setting for a year or two to build up hours and then apply. Medical school is actually similar too. The average age of a first-time medical student is about 26, 27. So there are not a lot of kids, there are obviously some that go straight from undergrad to medical school, but a lot of them take time off and work on real life skills. Yeah.
You don't take the GE to go to PA school?
GRE?
Yeah.
As far as I know, some schools, most schools don't require it. I don't know if that has changed. There's always changes in these sorts of things. Vet schools want GRE, but PA schools, as far as I know, do not care.
Just worry about your hours and your
Hours and grades, yeah. But, check the schools that you're interested in. Those things do change every now and then. Yeah. Go ahead.
Are there any public schools that have GO programs, or is it just private schools?
That's a good question.
Mainly in California. I'm just wondering in California specifically.
As far as I know, none are public schools. Yeah. Yeah.
With the hours, does it have to be like all one, like if I was like volunteering at a hospital, I have to have 1,000 hours there, or can I have like a couple?
You can have them all over. It's cumulative hours. And what PA programs actually do, they'll look at all your different hours and they will categorize your hours differently. If it's direct patient hours, they give those hours more weight than if it was like hours scribing where you never saw a patient or did anything.
Okay.
And so they will actually weight the different hours based on the different categories on how you collect those hours. Yeah.
How much, like, in time-wise, 1,000 hours, like 2 years? Do you, like, I don't know.
Let me think about this. So let's say you're doing, what's full-time? We're 40 hours a week.
Yeah.
You do 4 weeks a month, right? You're at 160 hours in a month. That's, if you're trying to hit, yeah, you're talking about 6 to 7 months of full-time work. So, if you can work full-time in the summers, let's say for 2 successive summers, that'll get you pretty close, right? And then if you do a little bit during the school year, that'll do it too. Okay, other questions? Okay. So, where can you get help? We really are here to help you. We have this thing called the Health Professions Advisory Program. There's a committee involved with this program, but this is the website. Go to the homepage if you have questions. The link is down here. We have a lot of information on this site in terms of what we do for you to make sure you're proceeding or progressing through the program, the curriculum here at Sonoma State appropriately if you want to do health professions. Okay? So all the contact information for the various people are up here, but the first thing you really need to do is make sure you get some advising help. You can always come talk to me. This is the current committee makeup. All of these professors are on the Health Professions Advisory Committee. You can talk to any one of these people. If you don't want to come talk to me, you can talk to anyone here. You can see we're all in different departments. And this is our contact information. Just come talk to us. Tell us what you want to do, why you want to do it, and we'll help make sure that you're on the right track. Okay? So, why is this committee great? Because we basically put you through the process of applying. So we're going to basically do a mock application with you. You're going to fill out some paperwork that has all your grades, it has all your work experience, it has all your volunteer experience. We're going to have you write a personal statement, and then you have to get letters of recommendation from people here, people you work with, supervisors, whoever, and all of that stuff gets submitted to your HPAC file. Okay? And in that file, we look at it, we evaluate it, and then we do a mock interview. We will interview you just like you were going to interview at a professional school. Students dress up, we're around a table, it's on a one-on-one, and that after that, we evaluate you as an applicant. So, again, think of it as a practice application, right? We're going to look at you, we're going to give you feedback along the way. We're going to say, well, you should probably talk about this more in your application, or, oh, you shouldn't say this during an interview. And that's really, really helpful. There's a lot of experience up here. I've been doing this. I've been on the committee for 5 years. Dr. Ply was the chair of this committee before I took over the chair of the committee. He's been on this committee for 20 years probably about now, maybe 15 years. So there's a lot of experience on here. We've seen a lot of kids be very successful here, go on to professional schools, and you've seen some of them come back and talk to you guys about their experiences here. So students are successful here, but you need to stay on it. You got to be organized. This is the file that I was talking about. There's a letter of evaluation that gets sent to the committee. That's basically a letter of references. We do an interview. We help you through the application. The one thing we do is we write a committee letter. So when you apply to your professional school, you can have a letter from the committee from this program, and that serves as one of your letters of recommendation. It's typically a very, very strongly weighted letter because we have a lot of experience. If you get a letter from some random person that has never written a letter of recommendation before, you have no idea if they know how to say things appropriately. So this letter is a very powerful letter. But the one thing is that if you go through this whole process and you thought it was a horrible experience, you didn't like us, you thought we were going to write you a crappy letter, there's no obligation to actually get a letter from the committee. It's all for you guys to practice an interview. Like, who here has never had a professional interview before? Oh, that's good. Most of you guys. Okay, so some of you guys have it. Those are the sorts of things that are really good for you guys to practice. Okay, so again, if you don't like the experience, I will tell you rule number 1, when you do the interview, don't cry. Every year, at least one student cries. It's not great. Everyone's kind of awkward. It's just like you're just sitting there. And so, but you would rather cry in front of us than cry on a real interview, right? And so this is really here to help you guys. Okay, so the last thing here, things to think about. There's, again, this is for medical school up there. There's a nice link up there that has a ton of information out there. This is how the process really works. There's what's called rolling admissions. This is true for a lot of the health professions. Rolling admissions means that the deadline might be in November, but they will start taking applications in June, right? That means that if you apply in June, they will look at your file. They will start saying, oh, do we want this person? Oh, we might want this person. Let's get this person an interview. You might get your interview offer before other people even apply, right? So is that a good situation? Yeah, it's a very good situation. If you apply at the deadline, they might have already started filling their class. So you're all of a sudden applying to a program that has a lot fewer seats than if you applied on day 1. So be on the ball, apply as early as practical. First day for medical school is June. I usually tell students, if you can do it by end of June, mid-July, you're okay. You don't have to be day one, but it takes them a while. So what the process is, you will have a primary application. This opens online a month before you can actually submit it. It's open online because you have to hand enter all of your grades, all of the stuff, your personal statements, all of your hours, all of your experience. That gets entered into what's called the primary application. Okay? Test scores, grades, experiences, personal statements, letter of rec all go into that primary application. When you hit submit, that goes to all the different schools that you apply to. If there are hundreds of medical schools out there. Most students apply on average to about 15 to 20 schools. All you do is you check a box which schools you want your primary application to go to. They get your primary application, they evaluate it. They will wait for your test score, so you can actually submit this before you get your scores back. It's a gamble though, because if you don't do well on the test score, it's gone, right? You can't not apply. Okay? So get all this stuff done as early as practical. They still, after you submit it, they have to verify all your grades. So you have to get them official transcripts. They look to make sure you didn't make a mistake, that you actually got the grades you said you got. So that has to all be verified. Takes them about a month to do something like that. And so you can see how the time keeps adding up very, very quickly. If they like you, they will send you a secondary application. The secondary application is more essays. Why do you want to come to our school? Why do you want to do this? Or why don't you want to do that? It's more essays, it's more money. You got to pay for each of these steps. But then after the secondary application comes back, they evaluate your answers, and then hopefully you get an interview request. You go on an interview, it's all on your dime. You got to pay for your flights, you got to pay for your hotels. This adds up pretty quickly. If you get a few interviews, that's great, but keep in mind, students that say, oh, I'm just going to interview or I'm going to apply, but I know I'm going to be better next year, I wouldn't do it. Put your best application forward. Wait till you're really ready. Don't rush it and say, oh, I'm just going to apply, and if I don't get in, I'm going to apply again next year. If you really don't think you're going to get in, I wouldn't waste my time, because it's a lot of money just to get a primary application out, get secondary applications out. That's, you want to wait till you're really ready. Okay, so in terms of exams, MCAT for MDs, DOs, podiatry, dentists take a DAT. Vets take GRE. There's no science content in the GRE. Okay, all these other ones have science in them. Optometry takes the OAT, and pharmacy takes the PCAT. But California pharmacy schools, for the most part, don't require the PCAT. So if you want to do pharmacy, you apply to California schools, you typically don't have to take standardized tests. Okay, so hopefully this gives you a flavor of the challenges, the hurdles. I encourage you to talk to me, talk to advisors, put together your own timeline, right? If you come see me for advising, I will help you put together a timeline. Don't let deadlines sneak up on you, and just stay on top of it. Okay, so again, if you have questions, come see me. This whole presentation is posted on the Moodle site for this class, so you can just download it. It's all up there. Okay?